Yeah, since Dr. Prakash Diwan sir has some technical issues, so shall we go to the next session? That
Yes, sir. Please
Atif,
continue.
Dr. Atif sir, Atif
Dr.
Sadiq.
Atif.
Good morning, good afternoon. Are you guys, can you hear me quite well?
Yeah. Thank you so much. So let our Dr. Arvind Gulbake sir to introduce you to the audience, because so we want to showcase yourself as well as the DIT University. So it is always better to introduce. Yeah. Dr. Arvind Gulbake is our assistant professor in the Department of Pharmacy, and he is one of the smart and the intelligent person in our department.
Perfect.
And so he is going to coordinate the whole session with you, and he will be there to take care of all the questions which will be coming into the chat box, and as well as the questions which are posted before your session also.
Certainly.
Right? So, okay. Thank you, sir. Dr. Arvind Gulbake, sir. Over to you.
Yes, sir. Thank you, sir.
You are able to get me?
Atif is a portfolio pharmacist and a co-founder and the head of the education at Primary Healthcare Development. And Atif sir is currently working as an advanced practitioner in the general practice, lecturer in the primary care pharmacy practice at the University of Bradford, training program director with the Health Education England, and a pre-registered coordinator with the Medicare Chemist. He is also the chair for the Royal Pharmaceutical Society Early Career Pharmacist Advisory Group. Dr. Atif studied on the 5-year sandwich course at the University of the Bradford, whereby he completed 6-month pre-registered training at the Rotherham NHS Foundation Trust and another 6 months with the Medicare Chemist Limited. He graduated in 2014. In addition to his association with the pre-registered training, Dr. Atif has helped with the development of the clinical pharmacist in the general practice, with the previous role involving the mentorship and supervision of the pharmacist in general practice, as well as being a module lead at the University of the Leeds for the part of National NHS England Clinical Pharmacist in General Practice scheme. As the independent practitioner, Dr. Atif's role in practice involving the diagnosis, management, and the acute presentation, as well as the medicine optimization. So we'll welcome Mr. Atif, sir. We would love to hear you from your side. Over to you, sir. Kindly share your slides, sir.
I'm unmuting. Now those symbols have come.
Thank you.
You are able to hear me?
Shall I wait for the interference in the background to cease before I start, or I don't know if I'm going to put everybody else on mute for now?
Then, Mike, you are able to hear me there?
Perfect. That is fine. That is fine. Right. Okay. Thank you ever so much for that introduction. First and foremost, if you can kindly just let me know whether or not you can see my slides on the screen there. Are they visible currently?
Yes, sir. It's visible.
Fantastic. And it's in presenter mode. Is that correct? If you want to just confirm.
Yeah.
Thank you. Thank you ever so much for that. Right. Then. So, yeah, thank you ever so much for that thorough introduction there. And thank you ever so much for Professor Chipmit for, inviting me to this virtual symposium. It's an honor to be presenting today, and I do hope you are all keeping well. So first and foremost, my heartfelt condolences to those of you who may have lost loved ones over the past year or so.
No problem.
Due to this horrifying.
You are able to see me?
Due to this horrifying virus that has really shook up the world. But at the same time, I would like to congratulate.
They have given me this thing only. Okay, now it has come. I think when what I should do is, once you start, I think I have to rejoin. Okay. Once it is finished, let me know. Okay.
Do we want to put Dr. Diwan on mute for now?
No, sir. Dr. Atif, sorry for inconvenience. Please continue, sir.
Oh, okay.
No, I can complete if he is agreeing for this.
Do you want me to carry on for now? I mean, I can hear people in the background, so it's quite disrupting. If everybody can maybe turn themselves onto mute for now, so I can continue, if that's okay.
Sir, okay, sir. You please continue, sir.
Okay, perfect. That's fine. Right. So yes, so like I mentioned, heartfelt condolences to all of you who may have lost loved ones over the past year due to this horrifying virus that has really shook up the world. But at the same time, I would like to congratulate many of you on the call today for all your efforts in helping your local communities to pull through this time of need. Now, as Professor Chitmay has mentioned, my name is Atif Sadiq, and I currently work as a portfolio pharmacist in general practice and academia here in the UK. And those of you who might not be familiar with the term portfolio pharmacist, I guess this is just a fancy way of saying someone who is or who has their fingers in way too many pies. So someone who is working across multiple work settings. And at present, I work as an advanced clinical practitioner in general practice, as well as a lecturer in primary care pharmacy practice at the University of Bradford. And my other roles do include, key roles with organisations such as Health Education England, Royal Pharmaceutical Society, as well as primary healthcare development and Medicare Chemists. So over the next half an hour or so, then, what I will be doing is I'll be talking to you all about the role of English community pharmacy teams in vaccination and public health, and I guess a key focus on our response to the COVID-19 pandemic. So I'll just bring up the next slide on your screens there, and hopefully you can see that on your screens as well. Okay then, so before I begin, I thought it would be useful for me to provide you all with just a bit of a background on the different types of patient-facing pharmacy sectors in the UK. And the different types of patient-facing pharmacy sectors in the UK are broken down on the different sectors of care. So essentially speaking, the main patient-facing sectors include community pharmacy, hospital pharmacy, and general practice / primary care networks. So these are there visible on your slides. And like I say, what I'm going to do is just a brief overview of each, because I did see some questions coming in previously as well in relation to how does community pharmacy or pharmacy services in the UK differ to maybe other parts of the world. So first and foremost then, the first bullet point that you can see there is community pharmacy. And community pharmacy teams are also known as retail pharmacies. So historically, they've been mainly involved in the supply and distribution of medicines to the local population, as well as providing or responding to common ailments. Let's just say people coming in with acute complications, acute problems, and things as such. But over the past few decades, then in the UK, community pharmacy teams have played a vital role in providing additional services such as medication reviews, immunizations, as well as focusing on areas such as disease prevention, management, and monitoring. So that's basically the general role of community pharmacy teams. In relation to the second bullet point and the third bullet point that you can see on your slides there, so hospital, general practice, and primary care network pharmacy teams, these teams also play a vital role in the medicines management side of things, as well as supply and optimization. But as mentioned on the first slide of this presentation, the key focus of my talk today will be the role of community pharmacy teams, i.e. retail pharmacies, in their response to vaccination and public health, particularly with regards to the COVID-19 pandemic. So that's a key area of focus for my talk today. So with that in mind, then, let's have a quick look at the different types of services that English community pharmacy teams are currently offering as part of their day-to-day provisions, as part of their day-to-day work then. So in the UK, community pharmacy teams are private enterprises rather than being owned by the state or the government, and they have the opportunity to provide both private services and NHS funded services. So obviously, with regards to private services, these can include things like supply of non-prescription medicines, things like paracetamol, ibuprofen, etc., as well as appliances, cosmetics, And in addition to that, private services may also include the running of clinics for provisions such as e-syringing, travel vaccinations, etc., etc. And although in recent years, more and more community pharmacy teams are building up their repertoire of private services, generally speaking, private services usually tend to make up only a fraction of the workload for most pharmacies, with NHS funded services being the main source of income for our community pharmacy teams. And as you will be aware, the NHS, in relation to the UK, the NHS is the UK's government funded healthcare system. And in England, when community pharmacy teams provide NHS funded services, they do so under something called the Community Pharmacy Contractual Framework. So you can see that there on your slides, CPCF, Community Pharmacy Contractual Framework, which in itself is broken down into essential services, advanced services, and locally commissioned services. So it's very important that we understand this before I go into the next point, because how things work, how the services are funded, what is the general makeup of the services is key to understanding the UK pharmacy response, or particularly community pharmacy response to the COVID-19 pandemic in terms of vaccinations, etc., etc. So like I say, it's very important that we understand this point here. So as a rule of thumb, then you can see 3 points there: essential services, advanced services, and locally commissioned / enhanced services. So as a rule of thumb, all pharmacies willing to operate in England must provide all essential services. So these include things like dispensing, promotion of public health, disposal of unwanted medicines. Let's just say patients have got lots of medicines left over. They can bring these back to the pharmacies, and the pharmacies will dispose of these in a safe manner. And these services are known as essential services. All pharmacies need to provide these services. In relation to the advanced services, then, these can be provided by all pharmacies if they wish to do so. So they don't have to provide them, but if they wish to provide these services, they can do, providing that the teams can meet certain accreditation requirements. So certain training needs to be undertaken, and advanced services, like I say, all pharmacy teams throughout England can provide, providing they have the right training and things as such. And at present, there are only 8 advanced services available for community pharmacy teams to provide. So these include things like hepatitis screening, medicines use review, flu vaccination service, and more recently, things like the COVID-19 lateral flow test distribution, as well as the pandemic delivery service. So I'm going to talk a little bit more about these 2 services in the next slide, but there are certain COVID-specific advanced services that pharmacy teams can provide. And the last point that I've got listed there is locally commissioned enhanced services. And these are those which are commissioned by local authorities in certain regions of the country based on the needs of the local population. So I'm originally from an area called Yorkshire. So in Yorkshire, if there's a massive outbreak of COVID, or if there are certain things that are required, for example, smoking cessation, prevention of cardiovascular disease, in a certain area, there is a certain need, then community pharmacy teams can put in a bid, they can apply to provide certain services which are known as locally commissioned enhanced services. So like I say, things like emergency contraception, smoking cessation, etc. are included within locally commissioned services. But more recently, I guess, and more importantly, there has been also the provision of the COVID-19 vaccination service as well as part of locally commissioned enhanced services. So I'm hoping that you guys are following me so far. So just a bit of a recap. Basically, with regards to pharmacy services in the UK, they are broken down based on the sector that we are working in: hospital, community pharmacy, or general practice. Thereafter, within community pharmacy, there are different levels of services, like I say, essential services, advanced, and locally commissioned / enhanced services. So based on what I've mentioned on the previous slide, then, what I would like to do now is look at the community pharmacy services that have been specifically commissioned by the NHS in relation to the COVID-19 pandemic. So as can be seen on this table here, and what I will be doing on this slide is going through each service by providing a rough overview of what it entails, as well as some information on things like funding and provisions available to community pharmacy teams from the NHS. So that's what I'm hoping to do over here for you all. Now, as you can see, then the first service that's listed on this table is the COVID-19 lateral flow distribution service, which is an advanced service. And this service involves community pharmacy teams making lateral flow devices or test kits available for asymptomatic people in the community to break the chain of COVID-19 transmission. So that's the key aim of this particular service. And this particular service is part of the government's offer of lateral flow testing to all people in England. And it works alongside the NHS Test and Trace's other COVID-19 testing rules. So it's part of the bigger picture for what the government in the UK are trying to do in order to limit the transmission of COVID-19. And in relation to funding then for this service, when it comes to community pharmacy teams and how the provisions are in place for commissioning, this service and through this service, all tests, so all the lateral flow testing kits are supplied to community pharmacy teams from the NHS, from the government, free of charge. And then the pharmacy teams provide these testing kits to patients, to service users, again, free of charge. And for their efforts, the community pharmacy teams receive funding from the NHS, which includes an early sign-up fee. So pharmacy teams that sign up to this service or sign up for this service will receive an early sign-up fee. They'll also receive a setup fee. So once they've signed up, they might need to put certain things into place. So a setup fee, which is a few £100s. And then thereafter, they will also receive a fee per transaction. So each time they supply a kit, a testing kit or a group of testing kits to patients, then they will also receive a service fee per transaction. So that's the COVID-19 lateral flow distribution service that pharmacies can choose to offer as an advanced service. The second service then that's listed in this table here is the pandemic delivery service, which is also another advanced service. And this involves pharmacy teams offering a prescription delivery service to patients to limit the spread of COVID. Now, at the time of launching the pandemic delivery service, so early April 2020, last year, government restrictions in the UK, particularly in England as well, meant that most people had to stay at home. And as part of the efforts to control the spread of coronavirus, we were told that we can only leave our homes for certain healthcare reasons, such as visiting a pharmacy, or maybe for essential items, things like food, etc., etc. Now, this particular service was originally commissioned across England to provide clinically extremely vulnerable patients, so patients that might be immunocompromised for whatever reason. This particular service was originally commissioned for them, to support them up until the end of July 2020, with obviously some specified local outbreak areas still being covered by the service until the end of October, because there was certain restrictions in certain areas of the country that carried on after the first lockdown. Now, this particular service was temporarily reintroduced during England's second national lockdown to cover the same criteria as above, but more recently, as of mid-March 2021, so just a few months ago, people who have been identified and notified by NHS to stay at home, let's just say if somebody's been diagnosed with COVID or is showing symptoms of COVID, then these people are now also able to access free delivery from their pharmacy of medicines and medical items under the pandemic delivery service as well. So that's basically an overview of the second point there. In terms of funding then, through this particular service, community pharmacy teams are provided funding for a daily rate. So they get a daily rate based on how many items they might dispense. So there's an equation that they do in the background to work out how much to provide pharmacies in terms of funding, but also with each delivery, so each delivery made by the pharmacy, there is funding available for this as well. And the final service, I guess, listed on this slide is the COVID-19 vaccination service, a service which many of you on the call today will be most interested in. And through this particular service, community pharmacy teams can register as a COVID-19 vaccination centre to both prepare and administer the vaccines. Now, since this service is a locally commissioned enhanced service, community pharmacy teams wanting to provide this service will need to apply to their regional NHS team. So remember what I said on the previous slide, any local services, you need to apply locally to your regional team. And this regional NHS team will assess the situation in the area. They will determine as to whether there is a need for a new vaccination centre. And if there is a need, they will approve the application. So the need obviously is determined by and based on things like the existence of other vaccination sites, such as if there's a hospital that might be administering in the area, or a GP practice, or other vaccination centres. So we will, the NHS team normally looks at all of these factors before they say to the pharmacy team, actually, you can go ahead and administer. If there's an area where there are lots of provisions already available, then chances are the NHS team will say, actually, in this area, we don't need another site. If there is an area where it's hard to reach, then they might say, actually, your support in this particular service will be most welcome. So it all depends on the local population needs. Now, if community pharmacy teams are approved to provide the COVID-19 vaccination service, then they will be expected to operate 7 days a week, vaccinating a minimum of 1,000 people per week. But more recently as well, I know that was something that the figure that was churned out initially during the initial phases of this service. But more recently, NHS have also said that actually, if there are very hard to reach areas, they are willing to decrease the number of vaccinations per week. Let's just say if you're working in an area where the population is not as much, and you are struggling to administer 1,000 vaccines per week, there is opportunity to administer the vaccine to a smaller cohort of people. So 400 people per week is the other figure that has been highlighted by NHS England. So essentially speaking, this particular service, as you can imagine, it's very valuable not only for the pharmacy teams, but also for the local populations, because depending on what your familiarity is with the community pharmacy environment, the community pharmacy atmosphere in the UK and England, there is usually often a pharmacy, within walking distance for most people, 20 minutes at least. Within 20 minutes walking distance, somebody can access a pharmacy throughout the country. So it is a massive key player in helping, obviously, with the rollout of the vaccinations. Now, funding wise then, for this final service, which some of you may be interested in, funding available to community pharmacy teams through this service covers and includes free PPE, personal protective equipment. And obviously, the pharmacy teams don't need to buy the vaccines. The vaccines are provided by the government, by NHS. So free vaccinations to the pharmacy team, also consumables as well, which can be very important. These little things you think actually might not make much of a difference, but free needles provided to the pharmacy teams as well. IT infrastructure, because every time somebody is vaccinated, it needs to be added onto their electronic record, as well as things like setup and venue hire. All of this is provided as funding, and then the pharmacy teams will normally get like a fee per administration of vaccines. So if they administer 1,000 vaccines, they will get 1,000 multiplied by the figure per vaccine, etc., etc. So it's quite good in terms of a business case as well, particularly if you're looking at community pharmacy teams who are also, like I say, known as retail pharmacies. So that was just an overview of these three COVID-specific services, and hopefully that is something that you have all found useful. What I'm going to do on the next slide then is highlight, the key challenges and also the key enablers, what key things have allowed community pharmacies to respond to the vaccination service in a seamless manner. So I'm going to talk both about the pros and the cons. I'm going to talk about the enablers and also the challenges. So I'll start off with the enablers, and thereafter I will move on to the challenges as well. Right, okay. So here we are then. So COVID-19 vaccination enablers. Now, this must be one of the key questions that will certainly be on the minds of all the listeners today. And this is, how competent are community pharmacy teams in administering the vaccination? And, what have been the key enablers to allow community pharmacy teams to take on the COVID-19 vaccination? So with anything, providing a new services, as is the case with anything in life usually, doing something new, providing a new service or taking on change is something that can always be quite challenging, particularly if this is something that an organization is not used to doing with. So, like most of the parts in the world, the role of community pharmacy teams in England historically, quite a while ago, historically used to revolve around mainly the supply of medicines and services related to this. And through our training and provision of services, us pharmacy teams are not usually very hands-on with patients. We get sometimes, I've obviously done some additional qualifications to work in general practice. And one of the key barriers, one of the key challenges that I found was being hands-on with patients, touching patients, looking at patients in that manner, assessing patients physically. So like I say, us pharmacy teams are not always very hands-on with patients. So the thought of, injecting someone can be quite scary. But I guess the welcomed reception of English community pharmacy teams in being able to provide the COVID-19 vaccination service does rely on two key historic vaccination programs that community pharmacy teams in England have previously been involved with. So in the past, community pharmacy, so I would say this is one of the key reasons why we've not panicked so much in England when we've been vaccinating patients, because in the past, there have been two key programs that we have been involved with, which are now listed there on your slide. So over the past 10 to 15 years, some community pharmacy teams have been providing private travel vaccinations. For example, administration of the meningitis vaccine, or administration of the diphtheria vaccine, things as such. And services like these were key in providing a platform for the second vaccination service that's listed on your slide there, the flu vaccination service, which now is fully embedded into the NHS pharmacy contract. And it's been there for the last 5 years. But the key thing is, I remember when the flu vaccination service came through, and all pharmacies were able to provide this, there was a state of sheer panic amongst the profession on things like training, administration technique, vaccination complications, so things like anaphylaxis. A lot of us were quite panicked, thinking, how are we gonna respond to this? But now that the teams are used to administering vaccines, the act of physically jabbing somebody is no longer a hurdle, and it was no longer a hurdle, in fact, when it came to the COVID-19 vaccination service. So hopefully the listeners on the call today can understand that there was a challenge previously, but then because obviously we've had these two historic programs running, I think pharmacy teams weren't too overwhelmed by the act of, or the need, or the way of administering the vaccinations themselves. So that was one of the key enablers in relation to the service itself. The second key enabler would certainly be the level of accessibility to training. So accessibility training in community pharmacy teams to administer the COVID-19 vaccination, like I say, is another key enabler, because what the NHS have done is they have made administration training freely accessible and available to healthcare professionals in the UK through their online e-learning for health platform. And I believe individuals and organizations in other countries are also accessing this free e-learning for health program. And they have also, the other key thing that the NHS have allowed is they've been quite flexible in certain areas. For example, the method of refreshing general vaccination training, so hands-on vaccination training, as well as things like basic life support training. So in the UK, normally, if you are going to administer a vaccine, ideally, you also need to know what to do if things go wrong. ideally you need to have basic life support training as well. And normally people renew this every year. But like I say, in response to the COVID pandemic, the NHS have been quite flexible in how people can refresh this basic life support training. In certain cases and in certain times during the pandemic, we were advised that some of this training can be done online, so we don't have to do it face to face as well, which was a key as well in relation to accessibility for the training side of things. So these are two key things that I've highlighted so far. Number one is obviously building up on historic vaccination programs. Very good, been very seamless for us. Number two is the accessibility to training. Number three then is the flexibility in service location. So, you know, another key enabler, like I say, is the flexibility in service location. So for those of you who are familiar with the legal requirements of operating a retail pharmacy in England, you'll know that there are certain restrictions in place as to the types of services that can be offered off-site. So there's quite a lot that we have to do in the pharmacy physical premises on site. There's a lot that we have to do. So there are restrictions and there's not much that we can do away from the pharmacy. And community pharmacy in premises in England, again, for those of you who are not fully aware, on average, they're not very massive properties. They're not very massive in terms of square feet, just over, I would say, maybe 1,000 square feet in size, which, you know, poses a massive challenge of administering multiple simultaneous COVID-19 vaccinations whilst also respecting things like social distancing. So like I say, the flexibility in service location has also been a key enabler for the COVID-19 vaccination service, because the NHS's flexibility, what the NHS have allowed is they've said that pharmacy teams can actually administer the COVID-19 vaccination offsite, meaning that they can hire out a sports venue or they can hire out a community hall and they can, you know, vaccinate patients elsewhere. So that's been another key enabler. Unlike most of our services, we have to do on site. With the COVID-19 vaccination, we've been told you can do it off site where there's more space. And not only has that been quite good for patient safety, it's also been quite good in terms of a business case, because it's put community pharmacy teams on the platform that they can challenge other providers. They can challenge hospitals because they can book out a big enough venue. They can challenge things like GP practice clinics, family doctors, because now they can hire out a venue that's big enough. And within a day, I mean, I was at a vaccination centre over the weekend with Medicare Chemists, and they were vaccinating up to 1,500 patients on that day. So you can imagine, you know, the possibilities are very fruitful, but also very useful as well in relation to ensuring that patients are vaccinated within time at a very good and safe rate as well. So that's, like I say, another key enabler, the flexibility in service location. Another key enabler then listed on this slide here is the inclusion of pharmacy teams in the state indemnity scheme. So in recognition of the uncertainties in obtaining indemnity provision for these new vaccinations, because normally, you know, there's a potential litigation case in place as well, isn't there? You administer a vaccine, things go wrong, patients can go down the route of, you know, bringing up a case against you in the court of law. So, like I say, another key enabler that has helped the COVID-19 vaccination service is the NHS's willingness to include pharmacy teams in the state indemnity scheme. And in this particular scheme then, what's happened is that pharmacy teams administering the COVID-19 vaccination are covered in relation to clinical negligence, which again is very reassuring for service providers. So these are some of the key enablers that have allowed us in England to seamlessly adapt and seamlessly take on the COVID-19 vaccination service. And one of the key things that you might have picked up throughout my presentation is the use of the term community pharmacy teams, rather than community pharmacists. So with any pharmacy setting, and this is something that I believe in, but also is the case on the ground, with any pharmacy setting, the wider team play a vital role in the provision of services. So the final key enabler, and this one I've done it in a fancy red color to make it stand out, the final key enabler for the COVID-19 vaccination service is the fact that the government's national protocol has allowed pharmacy technicians to also administer vaccines under the supervision of a registered healthcare professional. Now, this authorization is massive in relation to both pharmacy team response to the vaccination service, as well as, you know, what one of the speakers, honorable speakers before me was highlighting, is the recognition on the value that pharmacy teams can have in relation to response to things like the pandemic or just general healthcare. So our supporting staff can bring a lot to the table. There is a lot that we can do. And like I said, this final point is vital because we do need to make sure that we are making use of the whole skill set that we have in our pharmacy teams. So it's a team rather than pharmacists. There's other people within the team, and we do need to make sure that not only do we respect them, but we also make use of their services to the fullest of our extent. So these are some of the key enablers highlighted on this slide. The next slide, then I'm going to focus on some of the challenges as well, because as with anything in life, nothing is ever 100% perfect. And there is, you know, and there are always some key challenges that, you know, we face. There are, you know, key challenges that the community pharmacy teams have also been dealing with in relation to the COVID-19 vaccination program. So I've listed some of these on the slide here for you all to have a look at. And these challenges include the first one you can see there is competition from local vaccination services and other community pharmacy businesses. Yeah. So as you can imagine, as well as playing an important part to responding to this public health emergency and vaccinating patients, the vaccination services for healthcare professionals is also a valuable business opportunity. So for this reason, there has been competition locally amongst providers to secure this NHS funding. There's a bit of a race, you know, to secure the bid. And on the whole, relationship between providers have remained intact. So, you know, pharmacies with family doctors, with hospitals, the relationships have still remained intact. We are still working as a unit, as a team, but understandably, when there is an element of competition involved, this has caused some minor strains in historical relationships in certain areas of the country. So that, I guess, in itself has been one key challenge on the ground. So it might not be documented, but on the ground is something that we have seen. That's something that I have seen as well. The other thing as well is, although the technicians on the team can administer vaccines, although, you know, in other settings we've got the likes of nurses, doctors, physios, etc., all of these different healthcare professionals administering vaccines, you know, the day-to-day job must still go on. You know, pharmacy teams still need to supply medicines to patients that might not be suffering from anything COVID related. Pharmacy teams may still need and still are required to do things like, you know, a supply of medicines, diagnosis of patients, as well as things like medication reviews. And that does not stop. So although pharmacy technicians can administer the COVID vaccination, pharmacy teams are still required to deliver their day-to-day tasks. And for that reason, point number 2, to get sufficient staff in to administer vaccines can sometimes be a challenge, because we do need the teams to be doing their day-to-day tasks as well. The third point that I've highlighted there is volunteers required for upscaling. So what I mean by that is basically, if you imagine running a program whereby within one day you are administering 1,500 vaccinations, and whilst administering them 1,500 vaccinations, you are required to respect social distancing. You are also required to ensure that you incorporate things like prevention or recognition of anaphylaxis. So post-immunization, there's a time period where patients need to stay on site to ensure that they're not having any severe reactions to things like the vaccine. So all of this, as you can imagine, poses a massive logistical challenge. So that, I guess, is my third key challenge in terms of the community pharmacy vaccination program, is getting and securing sufficient volunteers, local volunteers, for even things like, you know, madam or sir, please can you stand here for 5 minutes, you know, and then taking in the next patients, moving them out. So we need quite a few volunteers as well. In most cases, people locally have been very kind to volunteer, which has been good, but equally in certain situations that has been a challenge as well. If we want to upscale it, we need more volunteers. And the last thing, which was highlighted by the previous speaker, the honourable gentleman, apologies, I cannot remember the full name, but was the vaccination hesitancy amongst the population. So as you can imagine, amongst local populations, there is, and sometimes there is obviously the vaccination hesitancy that has been well documented throughout. You know, people believing in a number of conspiracy theories, or people might not want to take on the vaccination for a variety of reasons. So that has been the final key challenge, I would say, in relation to this COVID-19 vaccination rollout. We see this particularly in our BAME communities. So we use the term BAME in the UK. I think it's probably synonymous throughout the world now, maybe Black and ethnic minority communities. So that includes people from the Southeast Asian backgrounds, Pakistanis, Indians, etc. Is that we see that COVID hesitant or vaccination hesitancy is more of a thing because, of historic events, or maybe because of other things that we might certainly believe in or we feel work well. So that's another challenge that has been the case in the vaccination rollout, not only for community pharmacy teams, but also the other providers as well. So these, like I say on the slide there, are some of our key challenges. And hopefully, like I say, that is something that you will all appreciate. So with all of that in mind, then, I'm just going to come on to my penultimate slide. I know I've been talking for a while, and I'll put you all out of your misery soon, not to worry. So I'll bring you on to my penultimate slide. And this one is just in relation to the numbers, just to summarize what things have been going. What does it look like in terms of figures? How have things been going on in the background, particularly in relation to the community pharmacy response to the COVID-19 vaccination service? So, as you can see there, in England, there are 11,500 community pharmacies. Massive potential for us to do something valuable. And of these pharmacies, back in February, so this figure is actually an old figure. It's from February. So this figure has likely increased. But back in February, 192 pharmacies were providing the vaccination service. Chances are right now, maybe 250 pharmacies are providing the vaccination service. And these pharmacies are vaccinating a minimum of 400 patients per week. But like I say, in some cases, at the vaccination center that I was in over the weekend, they might even be doing 1,000 plus vaccines a day. So, the numbers are there, and there is potential for us to influence very widely, very quickly, and very efficiently as well. So there is that there as well. So like I say, the potential is the potential for pharmacy teams to influence our response to the COVID-19 pandemic is great. You guys might have seen in the news today, or you might have seen in the international news, in fact, today, is that currently in the UK, 54.7 million people have received some form of vaccination, and up to about 21.7 million people are fully vaccinated, i.e. they've received 2 doses of the vaccination. And I feel that the community pharmacy and pharmacy teams in general have had a massive role to play on that in the UK. We have had recognition both locally from government and nationally from government as well. And I do feel that this is something that can be quite easily adapted into other healthcare systems throughout the country, throughout the world, in fact, sorry. So we have got the potential to make a difference. And it's now our chance, our time, our opportunity to step up to this challenge, because, we don't only just supply medicines. Pharmacists don't only just supply medicines. Yes, we are specialists in medicines, but there is a lot more that we can offer. And that is the end of my talk. I would like to thank you all for taking your time out in listening to what I've had to say over the last half an hour or so. And I would also like to obviously open the floor for any questions that you may have. By the way, before I do open the floor, if you have found this useful, if you want to get into touch with me as well, my Twitter handle is listed at the bottom of the slide, so at Atif Sadiq 04. We've also got the university Twitter handle and the primary healthcare development Twitter handle at the bottom, so feel free to get into touch. But like I say, open to questions now, kindly. Thank you.
Thank you so much, sir, for your talk. can explain about all regarding of
Sorry, finding it difficult to hear you, Dr. Gulbek.
Hello, am I audible?
No, you are not audible. Please
Hello.
close your, yeah.
Yes, now I'm audible.
Yeah.
So
hello, Mr. Samir. I have joined already.
Yes, sir. Thank you, sir. Prakash, sir. Just after this
You are
session.
able to hear me?
Yeah.
Oh, great.
thank you so much, Dr. Atif. You very well explained about the role of pharmacist community pharmacy in the England. With the support of NHS community pharmacy doing a great job in the England, I think. So I would like to take the few questions posted by the participants. So question number 1, sir, what is the role of English community pharmacist in the public healthcare?
Thank you for that. So English community pharmacists in the role of public healthcare then. I mean, some of the examples that I've highlighted already are in essence public healthcare, you know, the COVID vaccination service, pandemic delivery service, lateral flow distribution, etc. But if, and I will bring up the slide just to make it a bit easier as well. If we have a look at this slide over here, essential services. One of the essential services of the community pharmacy contract is to provide public health or to lead on, to champion public health. And basically through that particular service, community pharmacy teams focus on certain campaigns throughout the year. So for example, if there is a campaign in October, which highlights that we want to push people to stop smoking, then community pharmacy teams receive communication from national authorities and local authorities to distribute things like leaflets, to engage in conversations with patients about, you know, the risks associated with smoking, etc., etc. So throughout the year, through this particular public health service, which is an essential service of the community pharmacy contract, we often get a variety of topics that we need to focus on. But, you know, aside to this, any service that pharmacy teams that are offering in England, what they will do is they will provide certain general healthcare advice. So even when we are giving out medicines, you know, we're supplying medicines, we'll say, you know, dear sir, thank you ever so much for coming in today. This is your medicine for diabetes, or this is your medicine for cholesterol, which is fine. This is how you take it. You take one medicine or one tablet a day. But in addition to this, if you would like to have a conversation as to how you can manage your health or your lifestyle better, we can have a conversation with you. So we take them into the consultation room. We talk about things like diet, exercise, etc. So public health is embedded into every service, really. Yes, there is a standalone essential service that we offer, but equally we try to offer advice, etc., throughout our services. So that's hopefully a response to the question that you have there. I don't know if there's any follow-up in relation to public health, particularly there, Dr. Gulbek. You're on mute currently. Sorry, I think you're on mute.
Thank you, sir. So the next question, how the government of India can utilize the Indian pharmacist in the healthcare system during this pandemic?
Okay. So, I mean, that particular question then may be slightly difficult for me to answer. And the reason for that is because, unfortunately, I'm not overly familiar with the role of pharmacists in India. This is something that's quite new to me, and I have been introduced over the last few weeks, in fact. But I would say, obviously, in relation to the COVID-19 pandemic, as can be seen in the UK and in certain areas of the world, pharmacists can certainly help in a number of different ways. They can help in vaccinating patients. You know, we know about certain things as pharmacists. We've been trained up on things like anaphylaxis, what to do in response to certain common ailments. So I don't see why not the government cannot pass some sort of bid or law or some sort of ruling to say that pharmacists can also administer the vaccine. Number one, I think that is key. Number two is maybe getting pharmacists involved in other services. So things like delivery of medicines, things like testing. You know, pharmacy teams can provide a very valuable service in testing patients as well. And like I say, you know, I'm not very familiar with the breakdown of community pharmacies or retail pharmacies in India. Hopefully, I will learn more about this in the next few months and years. A very interesting area for me to explore, in fact. But the other key thing is, if we've got retail pharmacies on high streets, or if you've got a lot of them throughout a certain city or a village, then we can use these as testing sites. It's trying to be creative with what our pharmacy teams can do. But this is what the government of India can do. But I think our pharmacy teams need to put pressure on the government of India, maybe from the society, maybe from the council. We need to get together and say what we can do, because if we wait around and we want the government to tell us what we can do, nothing's going to happen. We need to show them what we can do. I think that's one key thing as well. The other point that I would like to briefly highlight, and this is a long-term plan, is maybe there needs to be a shake-up of the curriculum for pharmacists and pharmacy teams when they are training at universities as well. I don't know what the layout of that is like, but in the UK currently, we are moving away from a purely science-based pharmacology type degree. We are trying to incorporate therapeutics at an early stage. We are trying to incorporate things like point of care testing, hands-on diagnosis techniques. So I think that is maybe something that is, for the long term. But short term, we need to show the government what we can do and use these examples from other countries. Say, look, in England, this is what's happened. Why can't we do the same thing? So I think that maybe is something that is key. Is enabling us to vaccinate patients will be very, very useful if that is something that can be passed.
Thank you, sir. You very well explained and answered that question. So, okay, thank you once again, sir, for answering all those questions and for the great presentation. Thanks again, Dr. Atif Sadiq, for the nice presentation.
Thank you. It's been a pleasure, and I hope you all have a fantastic remaining of the symposium. I will need to leave soon, but best of luck to Dr. Diwan, who will be up next. And thank you ever so much for Professor Chitme, yourself, Dr. Gulbek, and the Director of Pharmacy who's smiling away at me there. Thank you ever so much for having me on this call.
Yeah, Dr. Atif, thank you so much. So hope to meet you again very soon. Okay, thank you so much.
Take care.
Yeah.